Nobody hands you a manual when you decide you want to get pregnant, and yet somehow the stuff that really matters may not come up until it's a problem. So let's fix that right now. I'm Dr. Angela Thyroid, and I'm a reproductive endocrinologist. I've been helping women get pregnant for over 20 years. And I still have people who aren't sure what they should be doing when they're trying to conceive. So you're not behind if you're feeling the same way. We're going to teach you what to do today in the preconception checklist. Just so you know, this is for everybody who's trying to conceive, whether you're trying on your own, with donor sperm, or with a partner. So it's for you. There's going to be a few little tidbits for partners too, but we'll save that till the end. Let's go over your body baseline. So this is probably one of the most important things, and that's your blood pressure. High blood pressure going into pregnancy increases the risk for you and your baby. It's easy to identify and it's really treatable. So you need to know about it, and you need to get your blood pressure checked before pregnancy, not later when you're 6 or 12 weeks into the pregnancy. Okay? Easy to do. Next, blood sugar and thyroid tests. People think these are for everybody, but they're really not. They're geared toward people who need them checked. Might be people with a history of diabetes, people over 30, people with PCOS, really people with recurrent loss. Your doctor will tell you if you need these checked. Certain things like insulin resistance or thyroid dysfunction can lead to irregular cycles. So if you're having irregular cycles, you're probably one of the people who's going to get these extra tests checked. Good to know. Bottom line, blood pressure for everybody. Thyroid tests and glucose screening, probably just for special populations based on your history. And if you're not sure, just ask your provider. The worst they'll tell you is that you don't actually need it. All right, next, vaccinations. So people don't usually put this on their trying to conceive checklist, but honestly, it really should be there. People don't know about it. It's really important before you're pregnant. I can't emphasize this enough. There's a couple of conditions, two in particular, Rubella and Varicella, German measles and chickenpox, that can both cause birth defects and make you pretty sick. And if you get them during your pregnancy, but you can't get the vaccine once you're pregnant because it's a live vaccine. So you have to really find out, do you have immunity before you're pregnant? And if you don't, you need to get the vaccine then if you want it. And we recommend it. So you want to get the vaccine if your immunity is low or gone, and then wait a month until you've got the immunity before you get pregnant to avoid having any complications with those diseases. It's also a great time to review your full vaccination profile and update flu or COVID if it's the right time of year. Get your Tdap, your Hep B, RSV, whatever you might be at risk for, talk to your provider. All right, next is folate. So why do you need folate? Well, you need it for the neural tube, which is the baby's brain and spinal cord. It closes in the first 28 days of pregnancy, which is way before many people even know they're pregnant. It's so important clinically for that process. So you need to get it on board before conception. The recommendation is 400 to 800 micrograms of folic acid at least 1 to 3 months prior to pregnancy. And if you've heard of the MTHFR mutation, meaning your body has trouble converting folic acid into a form it can use, you might have been told you need methylated folic acid. That form of folic acid has not been shown to reduce neural tube defects, so it's still important you get the regular folic acid, and you can take some extra methylated folic acid if you want that too. It also comes in green leafy vegetables and fortified foods like grains, so you can also get folic acid there. Okay, next, substances. I'm going to give you the evidence, not a lecture. And honestly, the evidence is pretty reasonable. So nobody's saying be perfect, but we want you to know the facts. Tobacco, which includes vaping, has the strongest data on both the male and female side. So for the person trying to conceive, tobacco can affect egg quality and ovarian reserve. And for partners, it can increase DNA sperm fragmentation, which can affect the embryo quality. So it's most important that you stop before you start trying to conceive. That's it. Simple. Alcohol. All right, for alcohol, it's not quite as strong on light drinking. Heavy drinking, probably best to avoid for sure. There's no safe amount, but if you were going to have a glass of alcohol, the safest time would be in the first half of your cycle before you conceive. Post-ovulation, avoid it altogether. And if you can, avoid it the whole time. All right, cannabis. THC can affect hormone signaling and ovulation. It can affect sperm motility and morphology. That's how the sperm look and how they move. So again, affecting everybody here. So it stays in your system long. So it's really best if you're trying to conceive to avoid cannabis, THC, marijuana, whatever you choose to call it. Okay, almost done. There's a few more things we need to talk about. The next thing is CBC, which is a complete blood count. That's going to check you for anemia, and it's worth knowing if you're pregnant. You don't want to be anemic going into your pregnancy. It's also the entry point for hemoglobinopathy screening, like thalassemia. So if something comes back abnormal, your provider will let you know, and your partner may also need to be screened. All right, STI screening. Not embarrassing, just factual. Chlamydia, gonorrhea cause silent damage to the fallopian tubes with 0 symptoms. So you can have no idea you've had it. You could have had it years ago and never know. HIV, syphilis, also around, should also be screened for these. Some providers also screen for herpes, which is HSV, and sometimes partners get screened too. So people can pass these back and forth. They can be silent. You cannot know. Pap smear and HPV screening, if yours is due, get this too. Preconception is a good time to do it because certain conditions cannot be treated well during pregnancy. You want to know beforehand. All right, we're really coming close to the end. The last thing is genetic carrier screening. Now, this one is, you might not have heard of, but basically it's a DNA test and it's completely separate from everything else we've talked about. It tells you if you carry a sign of an inherited genetic condition, okay? ACOG recommends 3 tests for everybody, regardless of your family history or ethnicity. That's cystic fibrosis, spinal muscular atrophy, and hemoglobinopathies like sickle cell and thalassemia. So being a carrier doesn't mean you have the condition, but it means that if your partner has the condition or a donor and you could have a chance of passing it on and having an affected child. So knowing ahead of time gives you options and time to make informed decisions. It can be done with a saliva or blood test, and sometimes it's covered by insurance. So let's recap everything. Blood pressure for everybody. Glucose and thyroid screening based on your history. Vaccine review, rubella, varicella, and everything else on the list. Folate or folic acid. Start now. And think about avoiding tobacco, alcohol, cannabis. Get CBC, STI, pap smear, HPV screening. Check genetic screening for CF, SMA, and hemoglobinopathies. That's your genetic carrier screening. Okay, so that's it. It's a big list. Now, you can go to your OBGYN and get all of this done, or your PCP. It really is the best thing to prepare yourself for a healthy pregnancy. And remember, nobody's perfect, so do the best you can, and good luck with everything. Thanks for joining me.